Welcome, Ashley, to Fast to Heal Stories podcast. We are excited to have you here. We have talked a little bit about PCOS or Polycystic Ovarian Syndrome in many other episodes, but we have to devote one specifically, or maybe another one in the future, but one specifically to this topic because it affects so many women and is such an issue with infertility. So we love that you are on today so you can educate us about this topic and hopefully give women some hope and guidance around this topic, because unfortunately, when women go to see their gynecologist or primary care physician, they oftentimes have no idea how to treat it, or just want to put these women on the pill and mask all the hormonal issues. And then they go off the pill and have more issues later on. So this is a very, very important topic. And I'm sure we'll talk about this during the podcast, but my daughter, who's 19 going on 20, was just diagnosed with PCOS last summer, which was a bit of a shock with, me being the big person who's educating everybody with insulin resistance. And, she hadn't been overweight. So that wasn't really on our radar, but holy man, she got her hormones tested and what a mess. So Ashley, welcome to the podcast. We're so glad you're here.
Thank you so much for having me. I love what you are doing and that you're raising awareness for PCOS, because you mentioned a couple of things that struck me. Number one, that your daughter is lean and has PCOS and just got diagnosed. And that's one of the complications, is that patients and even providers really aren't quite sure what PCOS is still. I mean, even though it was first recognized over 85 years ago, we still have no known cause. We have no cure, and diagnostic criteria is still very up in the air about what it is and what we do with it once we recognize a patient has it.
Right. Yeah. So why don't we'll take a step back and give us your story and why you're so interested in PCOS awareness. First, just tell us like what it even is. I know we throw these acronyms around when we talk about it from day to day, but what is PCOS and why are you so interested in bringing awareness to it?
Absolutely. PCOS is really a complex condition. Um, a lot of focus has been on infertility and reproductive health with PCOS, but PCOS in actuality is an endocrine disorder. So it affects our hormones, our metabolism. It can affect our psychological health and obviously our reproductive health as well. It affects up to 21% worldwide, or 1 in 5. In the US, the statistics are a little lower, so it's about 1 in 10, but it is a hugely common endocrine disorder. It can affect patients in multiple ways. So that's what makes it kind of difficult to diagnose. Signs and symptoms can vary in severity and the type of symptoms that each patient is presenting with. Some patients who are insulin resistant can present with being at a higher weight or obese, but there are also patients that are lean with PCOS. So there is no real set rules or singular test or diagnostic criteria that is set in stone with PCOS.
Yeah. And I know for my daughter, it was, I think, was it 2 of 3 diagnostic criteria that she had to meet. And nope, she wasn't overweight, but she had very high levels of testosterone and androgens. And the reason why we got her tested is because she didn't have her period for several months and she was struggling with acne for years. And we had done so many things to try and figure out what that was. We changed her diet. We, changed so many things, supplements. But when she went away to college and she hit a stressful time in her life, and then she didn't start sleeping as, her sleep habits changed dramatically with moving from home to college. And she's not a party girl. She's not like, she eats well, but just that stress, that whole shift of her having a completely different living situation and being on her own was enough to exacerbate it, where she came home at Christmas and said, I haven't had my period since I moved in and August. I'm like, what? Like that? No, that's not normal. And
Nope.
and I think a lot of, especially younger girls, younger women, they're not thinking about having kids yet. So they're like, oh, this is kind of cool. I don't have my period. Like I don't have to deal with that for, that
Exactly.
4 or 5 months. But I'm like, no, like that is a huge sign of health and hormone health and just your body saying you can or cannot carry a child and get it to term because it's not healthy enough. So we had to do some really deep diving and but yeah, she had very high levels of testosterone and cortisol, which really just kind of caused her body to spin out of control. And then she has some moderate insulin resistance as well. So I would imagine you have kind of your own personal battle with PCOS. Is that what brought you to this area of wanting to, study it and get some education out to women?
Absolutely. But before I dive into that, I just wanted to mention something off of what you said. That with the diagnostic criteria, there's a criteria called the Rotterdam criteria, which is what is usually used to diagnose PCOS. So you have to have two of three symptoms, one being the androgen excess that you were talking about, the second being polycystic ovaries, and then the third being irregular or missed periods. Here's the issue when we're dealing with younger potential patients, that a lot of times the symptoms mimic that of adolescence. So doctors will usually wait maybe 3 to 4 years after a teenage girl starts her menstrual cycle before they will actually feel comfortable diagnosing it as PCOS. The issue is by the time that happens, that's when a lot of them really start establishing those really harsh symptoms like not having periods and gaining weight and not being able to take it off. So, yeah, we have to start looking at that at a younger age. But my story started when I was much older. Well, actually, let me take that back a minute. It did start when I was young, but I didn't know it.
Mhm.
So when I was 13 years old, I had very irregular menstrual cycles to the point that I wouldn't have a period for a few months. And then when I did, I would pretty much hemorrhage. And the tipping point was I was in junior high school, sitting in class. And this is, kind of a hard story, but I think it's important to bring up that I was sitting there and I raised my hand and said to the teacher, I think there's something wrong. I got up and I had hemorrhaged all over in front of my entire classroom, which no young girl should have to go through that. So at that point, my mom said, it's time for you to go and see a gynecologist. We went to the gynecologist, explained all of the symptoms I was having. And basically he said to me, oh, don't worry. Girls at your age have a hard time growing into the hormones. Here's a pack of birth control pills. Stay
Mhm.
on these and, keep on them until you're ready to have kids. Okay, great. So I went on the pills. I stayed on them for close to 16 years. And there were little symptoms along the way. Like I would get a couple hairs on my chin or on my chest. And my mom would say, oh, just pluck it and don't worry about it.
Right.
I had at points acne where it was so bad, it was not just on my face, but like on my body. And I'm like, there's something not going right here. But again, I'm taking the birth control pills and it was up and down and changed diet and things would be okay for a while. And then they would get really nuts and then they would slow down again. So at the age of 29, I'd been married for a couple of years and my husband and I decided it's time to start a family. I went off of the birth control pills. Within a 3-month period, I had put on close to 80 pounds.
Oh.
Um, I started having skin tags, started seeing hair appearing on my face, acne, and all of these crazy things. Like I was trying to keep up with my diet and exercising. No matter what I did, I just kept gaining weight. And that was because with PCOS, the birth control pills are great, but they were masking the issue. Then the other thing that was happening was I wasn't getting my period. So every time I would take a pregnancy test, it would come back negative. I then went through seeing, I would say 5 to 6 doctors over a 5-year period trying to get answers. And a lot of times I was told, oh, you're just stress eating because you're trying to get pregnant. You're not taking care of yourself properly. No one really actually was listening to me. They were just assuming that I was doing things to create my situation. Then eventually I found this one doctor, and I said, I'm going to tell you my story because I've told it about 20 million times. And if you think I'm crazy, that's okay, because everyone else thinks I'm crazy. So I told this young doctor, and his eyes got real wide. He walked out of the room, and I'm like, oh my gosh, I have this rare disease. Why did he just walk out of the room? Came back in with a book, and he opened it up to the page, and he said, here, read this. And there it was, PCOS, 4 little letters that were going to define the rest of my life. And then from that point on, it was finding specialists and trying to figure out how to start a family with this condition and how to get my health under control. So it's still an evolving process. And the good news is I was able to have 2 children. I did need a little bit of help, but I did get pregnant, and that's something that I think is important to point out, because a lot of times, especially again when we're talking about younger girls, they'll go in and the doctors will automatically say, oh, you have PCOS, you're not going to be able to have children. That's not true. You do sometimes need a little bit of help with lifestyle management, medications, and sometimes therapies like assisted reproductive technology, but it's not impossible. So I had kids, and then after I had children, I found another doctor who specializes in PCOS and started on a path to better health with lifestyle management, supplements, medications. And, it's been an ongoing battle and an adjustment, because as I've aged, my needs and my body's needs have changed over time. So now I'm 52 and I am past reproductive years, but I still have PCOS. So that's another thing that I have to clear up. A lot of people term it as a condition of reproductive aged women. Again, younger women have it. And then women past reproductive years still have PCOS. It does not disappear. It is a lifelong condition. So now I'm dealing with metabolic issues of PCOS, which cause high blood pressure, higher cholesterol, weight gain. And it's a whole different ballgame with management at this point.
Yeah. And I'm sure there's so many women listening who are identifying with you. And if it's a 1 out of 5, maybe not in the United States, but 1 out of 10 for sure. I mean, that's a large percentage of the women listening to this podcast. And like you said, it's not like it just starts at 13 and it ends at when you're done having children. Like it continues to manifest. And most PCOS, not all, but a high percentage is driven by insulin resistance. So if you can't get it reversed and put into remission and it continues to be out of control, like you said, then you deal with blood pressure issues and type 2 diabetes and prediabetes and, these hormonal fluctuations and endocrine disorders can be just devastating. But the good news is I feel like we're starting to at least turn the tide a little bit in this area, because people are at least starting to hear about PCOS and acknowledge it and say, okay, there's something other than birth control pills that, like we have said, had just masked the problem, because basically birth control pills and synthetic hormones are just turning off communication from the brain down to the ovaries. So yeah, I mean, while you're on them, your symptoms may improve and sometimes they actually exacerbate. But yeah, it's like you saw, holy man, like you went off of it and it was like a switch flipped. I mean, 80 pounds in 3 months. That is hard to, I mean, you could binge all day and that would be hard to do. Just being completely out of control. Like there is something very wrong with your hormones if that is happening. And there's so many that just do all the right things and follow all the recommendations of the so-called experts, and nothing changes, and we're just told to move more and eat less. And it's like, that does not work when we have insulin. Well, I mean, it might improve insulin resistance, but it's not the correct way to treat it. So it's not addressing the insulin issues. So yeah, it's just heartbreaking. And I think education is vitally important. And I look at my own family, and I almost wonder if I wasn't tested in high school, but I was like my daughter. I was lean because I was very athletic, but I would lose my period for like 5, 6 months at a time, especially when I was like playing basketball. And I just chalked it up to, oh, it's my body composition. Um, but I don't know, because then in my early 20s, I went on birth control. I got
Yeah.
acne from birth control. I struggled with that. My mom for sure had PCOS. She lost almost all her hair in her 30s. She had a hair system, up until this day. She wears wigs now. My younger sister, very thin hair. I know she's got cortisol dysregulation because she's a total night hawk. She wants to sleep. She's in her 40s with kids. It's like she doesn't want to get up in the morning until 10 or
Yeah.
11. She wants to work night shift because her cortisol is so dysregulated. Struggled with her weight her entire life. So it's like women think there's something wrong with them, or they're not doing something correctly, but these hormonal issues are very real, and they're strong. I mean, just with my daughter, I mean, I'm an expert at reversing insulin resistance, and it has been a beast to get under control. And for her, and she understands, like she understands the disease process. She understands what is helpful and what makes it worse. And if you're just going through life and you have no idea what's wrong with you, let alone how to treat it, I mean, it can be devastating. So I'm curious, like, do you know like what the actual hormone fluctuation that was causing your hemorrhaging, and were you able to get that under control? How did that work? Like, I'm just like, gosh, that's because I have a couple of friends too who are like their shoes have gotten ruined because of the heavy bleeding.
Yeah, well, that's the one thing that was really great about being on the birth control pills. And yeah, I mean, it's a catch-22 with the birth control because it can help with so many symptoms. And when I was taking the birth control pill, it brought down my androgen levels, and restored my menstruation where it was fairly regular, which is really important. And you know guys, not having a period and not being on like a birth control or something that's controlling when you have your periods is not the greatest thing, because what happens is your uterine lining can build up, and that's when you have problems with the hemorrhaging, with polyps, with endometriosis, with hyperplasia, which can lead to endometrial cancer. So, it's one thing when you're on the pill and it's controlling if you want to have your period every 4 months or not even have a period. They do have birth control pills that do that, and that's perfectly okay. But for your body to like naturally respond with not having a period, not so great. So the birth control pills helped even out the hormones, and helped regulate my menstrual cycle. And I think that was the key in those fluctuations kind of evening out a little bit, because at the time I went on the birth control pills, my gynecologist really didn't talk about it. I'm not really sure what my hormone levels were or my labs. And at that period of time, I mean, I started doing this back in the dinosaur ages, so there wasn't a lot of information on what the appropriate lab tests were at that point.
Sure. Yeah, and that's the thing. It's like there's just not anything really definitive. And as we talked, my daughter had really high testosterone and missed periods. So she didn't have, I mean, we haven't done any kind of scans or anything for the polycystic ovaries, but to see if that is something that she is dealing with. But I know that that's possible as well. So have you, moving on to kind of like what you've done to try to bring this and manage it, put it into remission. And you said it's still a work in progress. I mean, here you are 30 some years late, and it's just, it's not something, genetically it's there and your predisposition to it. Obviously,
Correct.
some lifestyle habits exacerbate it. Some will help to put it into remission. But what have you done personally? Let's start with like diet. Has there been anything that's been real effective for you to try to manage this, or things that make it better and worse?
Oh, absolutely. And I will say this, not, well, I guess for me personally, but for most people, lifestyle management is the foundation of changing things around with PCOS. With saying that, not everyone who eats right, exercises right, or sleeps as much as they're supposed to is going to have success with lifestyle management alone. I certainly did not, but I improved my health and through understanding nutrition. Basically, it wasn't like calories in, calories out, and restricting the foods I was eating, because I tried that and it actually made things worse.
Mhm.
What I didn't recognize was it was the types of foods that I was eating. A lot of times processed foods, things that are high in carbs, like white rice or white bread, was not my friend. But when I learned that there are options where if I increase my fiber or I eat more green leafy vegetables, that was making a difference and helping my body absorb the insulin and therefore helping bring down inflammation and helping bring down the androgen excess. So that was a really big help. Another thing that I did wrong, and I did a lot of wrong things in the beginning, but another thing that I did wrong in the beginning was I was told to start exercising more. So in my brain, that meant, okay, you're not losing weight, you're not exercising enough. So I started going hard at the gym. I mean, more than I think most athletes even do. And what I did not realize was that that exercising that hard was stressing my body out. So there's a thing called oxidative stress. And that oxidative stress was causing my cortisol levels to go up. It was causing inflammation. I was bloating. And it was having the opposite effect because I didn't know how to exercise properly. So there are a lot of PCOS personal trainers that help people design plans that will work for them. Because the key is not going hard, it's finding something you enjoy and sustainability. So any kind of movement is good movement and takes you towards a more positive goal. The other thing that I had to learn was stress. That was a huge factor that, I was stressing out so much about the condition and, not having success in losing weight or getting my symptoms under control. I was stressing myself out. So I had to find times to just kind of breathe, to meditate, to go for a walk, to help myself kind of decompress and again bring those stress levels weighed down. And lastly, and something you mentioned as well with your daughter, is sleep. Because of everything going on, my sleep patterns were horrible. And I didn't realize that sleep can also affect insulin. And if we're not getting enough sleep, our body's not able to process the food, our metabolism slows down. So these were all lessons learned, and lifestyle management has been great in helping me establish that. However, because I got diagnosed later, because there wasn't really an effective and sustainable management plan, I have struggled with weight since I was a teen, still do. My insulin kept going up, so I am now a type 2 diabetic. I do have to take insulin sensitizers. I do take supplements that can help process the insulin, but it's a struggle. And at this point in my life, I wish I would have known everything that I know now. And that's why I'm out there kind of pounding the pavement, talking about PCOS and education, because I don't want future generations to go through what I went through.
Right. And the longer you've had a disease process going on, the harder it is to reverse and put into remission. So, I mean, I have people join my insulin resistant courses to reverse it, and it's a big, huge spectrum. I mean, you can have, like you said, just a teenager or someone in their early 20s just starting to have some symptoms of insulin resistance. And some things manifest, and a few tweaks, some, time to eating and a little bit of intermittent fasting and carbohydrate reduction and bringing that insulin level down within a few months, they can be great. And then there's people who, who have long standing insulin resistance up on the type 2 diabetes spectrum. But they didn't have any idea what they were dealing with. And now it's been 40 years on the spectrum, and it's going to take a more work, more patience to start to turn that around and treat it and keep it in remission and manage it. I mean, it's a huge spectrum. So, the work that you're doing is so important. And, I mean, you didn't know any better when when you started with all of this. But I love how you mentioned that the lifestyle is foundational. And I tell all my followers that with whatever is driving insulin, whatever disease process your insulin resistance is driving, whether it's prediabetes or blood pressure issues or PCOS, it's like you can take 25 supplements every day if you want. But if you're not sleeping and you're not eating well and you're not getting movement, and you're stressed out, like you had mentioned, stress is a huge factor. And I see that with my daughter all the time. It's like she'll have her acne managed and then she'll go through a stressful week. And it's like, well, we know what is driving this. But it takes a long time to figure out, and it takes a long time what is going to work specifically for you. And everybody's a little bit different. Like I have a few targeted supplements that I recommend for my people with blood sugar issues, but that's not to say that everybody should be on the same dosage at the same time, taking the same thing. And supplements are just that. They're supplementing those foundational lifestyle strategies that are critical for you to manage if you want to keep your disease process in remission or achieve remission in the first place. I mean, it's just, we've said you can't out exercise a crappy diet. You can't out supplement those good foundations either. So what do you have targeted supplements that really help your personal disease process?
Yes. And thank you for saying that, because I really have to stress this, that what works for me may not work for someone else. PCOS is very individual as far as what is going to work for us personally. So I have no problem sharing my supplements, but please, guys, before you take a supplement, talk with your doctor, get your lab work done, and make sure it's the appropriate supplement for you. So one of my favorite supplements that I swear by are the inositol. And it's a naturally occurring supplement in our bodies. And a lot of times with PCOS, we are deficient in inositol. So inositol is very similar to a medication that's out there that a lot of us have used and know about, which is called metformin. Now, the problem for a lot of patients with metformin is when you take it, it usually causes some pretty major IBS issues for when you're starting. And that's basically because the body is trying to reduce those insulin levels and your insulin is fighting against that. And then you're just not feeling so great. The thing with the inositol is it's a lot easier on the system. I can tolerate it. It has helped improve my metabolic profile. It has helped lower my cravings. And to an extent, my hunger as well. It helps with that as well. So that supplement I absolutely love. Another one that I take, and I only take this again because I had lab work done and I know I'm extremely deficient, is vitamin D. A lot of patients that have PCOS are also extremely deficient in vitamin D. So that's one that I would recommend people getting checked. Has made a huge difference as far as fatigue with me, because I was to the point where I felt like I couldn't get out of bed some days. And just taking that vitamin D supplement has turned things around. And likewise, the other one that I'm fairly deficient in that made a huge difference was taking vitamin B. So the vitamin B helped with the energy. It again helped with metabolism. So those have been my three supplements. I also take a multivitamin because I was told that, again, we're talking about foundational, that the multivitamin gives me a little bit of everything, which is good. And my body uses what it needs and gets rid of what it doesn't need. And then I have those extra supplements for things that I have a little more trouble with.
Yeah. And the inositol, I had never heard of that. I think a little bit until I really started specializing in insulin resistance and then specifically for PCOS. And I know my daughter puts that in her water every single day, and that can be game changing for women and bring that cycle back, relatively quickly. Um, have you seen, I think I've asked other people about this, but they weren't real sure about it. The 40-to-1 ratio with the myo-inositol
Glad
versus
you brought
pyro-inositol, is that something to look for? Or like I've seen some people really support that and others don't.
There is actual research that supports it. And when you want something that's as close to the process in your body as possible. So there are companies that create a product that has that 40-to-1 ratio, and that's because that's how the myo and dechiro inositols occur in your body in that ratio. When you are over supplementing or under supplementing with just myo-inositol or dechiro, you may not get the effectiveness that you get from doing that 40-to-1 ratio. So that's something that you want to look for. Also, supplements are not regulated by the FDA, but there are certain groups that will review the supplements and hold the supplements to a higher standard. So when you're reviewing supplements, you also want to look for those higher standards on those labels to make sure that they've been through some, process to ensure that they're safe and effective. And definitely there is a ton of research on PCOS and inositols. If you just go into what I like to do, because I'm such a nerd, is go onto the Google research, just put in Google research, and then it'll pull up all of these studies. Now, I know some of it can be a little hard to read, but just if you go through and just read like their final conclusion on things, just to see what the research revealed, it can be really helpful in helping you determine what might work for you.
Yeah. That's great to know. So I would agree with everything that you said about supplementation. The inositols, the chiroinositol, vitamin D. I mean, I live in Wisconsin, so definitely we 6 months out of the year, our whole family, we keep our vitamin D right at the table. We take it with our meals. One of my sons gets tested pretty regularly because he's had autoimmune issues. He's always chronically low. I haven't had my daughter tested with that, but yeah, I mean, if you are north of, I think there's some line in Missouri, like you need to supplement with that. And I know I notice a difference with my energy levels as well. The B vitamins, yeah, especially I know so and maybe you can speak to if you know much about the Dutch test, the dried urine testing for comprehensive hormones. That's how we diagnosed our daughter, and we found that she wasn't the greatest methylator either, and so she's on some B vitamins to help her with that. But that's the route that we went to help get her diagnosed. Is that the best route that you see? And the problem, I shouldn't say it's a problem. The one negative about Dutch testing is it's expensive. I mean, it's like $400 to $500. Usually you're paying out of pocket because it's not covered by insurance, and you need to go with an integrative or naturopathic doctor to even get it. I know I can order them for people as a practitioner, but it's one thing to order them. It's another thing to interpret them. I mean, it's a steep learning curve to know how to properly interpret them and how to get people the correct help that they need based on their results. And the same thing with supplements. Like as a practitioner, I encourage all my students to establish a full script account with me. Like, it's practitioner grade supplements that have all been third party tested. It's a huge database, but at least you know that there's been testing and regulations placed on those, and you're not just buying them off the shelf at some pharmacy. But yeah,
Exactly.
the diagnostics, I know we talked about the criteria, but what's the best way to go about, in your opinion? And then I know everybody's a little bit different with this an opinion, but like, if you suspected somebody had PCOS, what would you point them to for testing?
Well, here's the first thing. Let's start with this. In order for someone to get a proper diagnosis of PCOS, you have to have a provider that understands PCOS. That's
Bingo.
that's that's the biggest problem.
Yeah. Luck,
That
right?
I how do I put this gently? There are a lot of providers who specialize in the symptoms of PCOS. So if I'm having reproductive issues, I will go to my OBGYN. They may not understand PCOS as a whole body condition and just deal with that one particular area, and therefore will just test, diagnose, and take care of things in that infertility spectrum. You might go to see an endocrinologist who's not really worried about anything except your hormones, but may not do all of the tests and again consider all of the symptoms and issues that you're dealing with. So for me personally, and I might get some pushback on this, but for me personally, when I seek care or when I recommend care for others and diagnostic, I want somebody who's going to be able to sit down and listen to me and listen to my lived experience, and someone who is going to be able to look at this as a full body condition. And I have repeatedly found that some of my favorite doctors to work with on that would be either the naturopathic or the integrative or functional. I just think they have a different approach, and a lot of them will use the Dutch testing because it gives a different perspective than just running a blood test panel where maybe you're testing for testosterone, where, just a basic testosterone test might come back normal, but if you're testing for free testosterone, that might come back telling you, oh my gosh, these levels are much higher than they should be in most people. So there are a lot more nuances in things like the Dutch testing than I think just picking and choosing a couple of varying lab tests to try to diagnose PCOS. So yeah, I think providers, again, need to listen, need to be fluent in PCOS. But the problem is, in most of these specialties, they maybe spend 5 minutes on PCOS in medical school. So again, unless they take it on as something that they specialize in, they may not be your best choice. So question the doctor, ask them questions about, what do you know about PCOS? How have you treated PCOS? How have your patients responded to PCOS? Just like anything else that we do, like if we go shopping for products, we look at labels, we figure out what is the best match for us. It's the same with doctors as well. You got to find your best fit. And I just say, do a lot of research, ask a lot of questions, and read the reviews on people.
I know. And I know sometimes I'm quick to come down on conventional medicine and say, oh, I'm very apprehensive to take my own family to the conventional system. But you just have to remember, they were trained how they were trained, and they were trained more in pharmacology. Same with nutrition. I mean, they got about a half an hour, a couple hours of nutrition education in medical school. And so many disease processes are nutritionally based, but they just don't have the tools to manage it and treat it nutritionally, because they weren't taught. So you can't expect them to be able to treat and use all of the tools that I would know, because they weren't. I mean, I had to retrain myself. I was trained in the conventional dietetics system, and I basically teach the opposite of what of what I used to. So it's just, it's hard. It's hard because these disease processes are becoming more and more prevalent. But instead of, we can't focus on treating the symptoms. I mean, yeah, we want to manage the symptoms. We have to figure out like what is driving this process in the first place and deal with that. So yeah, it's not like, it's a hard answer. It's a
It
hard
is.
question. It's a hard question to answer. Um, but I think, like you said, like you just have to ask a lot of questions, and no protocol, no treatment is going to be exactly the same from person to person. Um, and you just have to figure out what does work for you and be patient. I mean, so people are like, if it doesn't happen in those first couple months, they just want to give up and go back to whatever they were doing that started to drive the disease process in the first place. But have you found spearmint tea to be helpful for you individually, or have you known other people to respond to that?
I've seen a lot of people that seem to respond really well to spearmint tea. For me, it really didn't work. And again, I probably attribute it to the fact that I am so insulin resistant
Yeah,
that,
yeah.
um, I'm on more medications than I can count. And, even that's still a struggle. So, for me personally, because of where I am in my journey, no, it hasn't been as effective for me, but I have seen a lot of success for other people.
Yeah, yeah. And I know with my daughter, she just kind of started that in the last couple of months, and she's like, I can feel it helping. And she's like, I didn't think I'd be a tea drinker, but I love this tea. And it's, I'm like, well,
Yeah.
maybe your body's like craving what is in it almost. And some nights she'll be like, I can feel my skin starting to hurt and tingle, and I'll drink a couple of mugs of that, and it immediately feels better. But yeah, I mean, it's just one of those things that will most likely help a lot of people, but maybe not. So the last thing I'd like to ask you about, because this podcast, we do talk a lot about intermittent fasting and, fasting protocols to help reverse insulin resistance. But I do, when I work with a student with PCOS, it is very nuanced. And in my courses, I teach, one specific lesson for those who have PCOS, because it's very easy to overdo, like you were saying. And a lot of women, probably almost all of them with PCOS, also have cortisol issues, from stress, and cortisol being high when it should be low during the day, and low when it should be high during the day. Our cortisol should be higher in the morning than it is in the evening, and a lot of times with people with PCOS, that's reversed. So we have to be careful not to over fast. So I know for my students, I start them out really kind of low and slow, see what they're tolerating. And I have found for those that are struggling with either adrenal issues, cortisol issues, PCOS, that sometimes like eating earlier in the day can kind of help to correct those cortisol variabilities that are sometimes kind of opposite of what most humans are seeing. And that's just kind of part of that disease process too. So what are you seeing with intermittent fasting? Is that something that you practice, or you've seen much success with?
Um, Again, me personally, because of my issues with insulin, I kind of have a different approach that I take where I'm eating meals more frequently throughout the day. So I'm eating like 6 times a day just to keep my insulin levels. However, um, there are a lot of practitioners that I work with who prescribe intermittent fasting and have had extreme success with their patients. And there are a lot of community members that talk about intermittent fasting, which have said that it's been a game changer for them. And again, I just really think it's where someone is in their journey. Maybe not so much for me, because at this point I'm a hot mess. But for but for people that may be just starting their journeys or making changes in the middle of their journeys, that could be a really effective plan.
Yeah, and I know I've talked to other women with PCOS who, like, intermittent fasting and doing some longer fasts at the beginning was very, very helpful, but then they did back off and didn't overdo it, because so many women, I mean, were just A little bit is good. Oh, my dog will not stop shaking behind me. A little bit is good, and a lot, more is better. So I think we just need to be careful and know that um PCOS is a little bit different. It's not exactly the same as the protocols for prediabetes or blood pressure, and you definitely don't want to overdo things. Well, thanks for all of your education today. Where can we point women? I know you have lots of resources. If somebody
Yep.
suspects that they're dealing with PCOS and they want some more information, where should we point them and what are your resources?
Okay, so there are a couple of different things. The one resource that I point everyone to, because if we want all of this to change and we want more awareness, we want more research, we have to advocate. So there is a great organization called PCOS Challenge, which is the National Polycystic Ovary Syndrome Association here in the United States, and they do things worldwide as well. But that would be a good start. They have a lot of information, especially when it comes to raising your voice and advocating. As a matter of fact, on March 2nd, Tuesday, we have our 6th annual PCOS Advocacy Day, and we will be talking to legislators on Capitol Hill about raising funding and awareness and signing resolutions to help patients who have PCOS. So that's a really great resource, a really great way to get involved, to meet other community members, and to volunteer. I have a lot of resources and I connect with a lot of providers, researchers, patients, coaches, nutritionists on my social media, which is PCOS Girl, which is PCOSGURL, just because I have to be fancy and throw a U in there. So, so PCOS Girl on Twitter, on Facebook, on Instagram. And if anybody ever has any questions or wants to be pointed in a certain direction, I am more than happy to help.
Thank you. We need about 1 million of you out there advocating, and I wish you the best of luck on March 2nd. And I believe this podcast will air after that date, but I really hope we can bring some awareness and some funding. I mean, funding is is critical for studies and so many things. So thank you for all the work that you are doing. We will definitely link all of those resources in the show notes and point people in that direction. And, support is so critical too. I mean, I know you feel so alone in this when you're dealing with these hormonal issues. And another thing we didn't really talk about is, the mood changes and the depression and, feeling alone in this and feeling like you're just not moving the needle. But there's so many out there dealing with the same thing. So getting the support you need is definitely critical. So thanks so much for coming on and sharing your knowledge with us.
And thank you for inviting me and allowing me to share my voice and experience. It's greatly appreciated.